Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome back to The Point Fort Wayne. I'm Kassee Lamm with Apex Benefits, and today I'm so excited to be recording with Leslie Friedel at Visiting Nurse here in Fort Wayne. Leslie, can you take a second and just introduce yourself and how you got started and what brought you to Visiting Nurse?
Sure. Yeah, I'm Leslie. I've been with Visiting Nurse for about 2 years, but I have spent my entire career in nonprofit work. So I started out, I'll go way back. I started out when I was 16 as a hospice volunteer, I started out when I was 16. I actually lost a family member to cancer, and they were served by hospice. So when I was 19, I became a hospice volunteer to give back the way that somebody had given to our family and allowed for my family to be able to, that was a long journey, and having somebody sick and having a volunteer come in and just relieve my family to be able to go grocery shopping, just step out of the house for a minute, take a break. So when I was 19, I decided that I wanted to do that. So I actually was studying accounting in college, and I decided to switch my whole career from accounting to social work. And so I have graduated with a social work degree from St. Francis and started working in community mental health and spent some time doing different types of things. But I ended up working at a retirement community in a nursing home when I was a young adult, and I really loved it. I loved just working with people, learning their stories, spending time with different families and family dynamics, and working on through really challenging situations. So when it came time to figure out what I wanted to do next in life, I decided to go back for my master's in social work. So I started studying at Indiana University for my master's, and after I was done with that, I wasn't sure what I was going to do next, if I was going to stay in social work. And at the time, the CEO of the organization I was working for asked me to get my health facility administrator's license to open up a new nursing home. So I did that, and had to study for state, federal exams and pass my test, and then I opened up a new building as a new administrator. It was a pretty challenging time, but I was able to, through that experience, start working more closely with hospice again, and working as, from the other side, looking at what kind of contracts, what kind of partners did we want for hospice, and
Right.
Visiting Nurse was always top of mind. First contract I signed for that new building, and just thought it was really important to bring in people that really cared and really did a good job for our residents at the nursing home, but also had some longevity in the community. So a few years later, I started doing more research and development work for that organization, and then found my way to Visiting Nurse. So I've always had a huge respect for Visiting Nurse as an organization, as the type of individuals that work for Visiting Nurse. There was always a really big, they were a big part of, they were a really great organization, and I just was really thankful to have an opportunity to now be working for Visiting Nurse.
That's awesome. Well, we're so glad that you are, as an organization here in Fort Wayne, it's such a service that's needed. And can you explain to our listeners a little bit more, just for those who may not have experience, what is hospice? What does that mean?
Sure. So Visiting Nurse has a couple different things that we do, but hospice is one of the largest things we're known for and one of our largest areas in which we serve. So hospice is for those who have a chronic or life-limiting illness, and with normal progression of the disease, they'd have 6 months or less left of life. And so what we do is we come in and we serve those people, and we have a physician that's monitoring their medications, pain, looking over everything to keep them comfortable at the end of life. We have RNs, nurse case managers, we have social work chaplains, nurse aides that all go in and kind of just surround the family and keep them comfortable for the time they have left. The one common myth about hospice is that it shortens life expectancy. So typically people think if I come on hospice that I that I'm calling it quits. And many times with the team surrounding them and the pain medication and medications to help solve for symptoms, there's often a better quality of life, which ultimately leads to a longer quality of life.
Sure. So your grounds are beautiful, the facilities are beautiful. Can you talk a little bit about like where Visiting Nurse started and how you've remained successful for over 130 years, right?
Right, yes. Visiting Nurse has been around for 132 years. We actually, in 1888, we started, we have served through many things in history, pandemics, the 1918's flu, the polio epidemic. We've just served through a lot of different things, but originally we didn't start as a hospice agency. Hospice really became, the word hospice became a benefit really in the 90s because of Medicare. Medicare
Right.
recognized it as an important hospice benefit, but we really started by just serving what we called the sick poor at the time. So we would go out into the community, start out with just one nurse on a bicycle, going out into the community and serving those who needed help. Most of the time it wasn't a nurse, and the original worker wasn't a nurse, but eventually we hired our first nurse, and we were able to start growing our mission that way.
That's really exciting. So what's the different buildings on your grounds? What purpose do they serve?
Sure, we have a couple different, we actually have location here in Fort Wayne. We also have location in Bern and also in Marion, but our location here in Fort Wayne has two different buildings that you'd see if you come on campus. One is our hospice home building and our administrative offices, and hospice home is really a 14-bed unit that serves people that are having symptoms that can't be managed in their home setting. So it's just a beautiful space, and I hope anybody that's listening would come out and just see it. It's just amazing to see the peace that you feel when you walk into that area. It's not like anything I've ever experienced before. I actually remember the first time I came to hospice home before I was worked here. I was actually a social worker, and they just invited me to come down and see it. And when we were building the building I was working on it to work as a nursing home, I said I want it to be just like hospice home. It's just so peaceful, and you just walk in and you have a sense that you're taken care of, both emotionally, spiritually, and physically. And so that area is really a big part of our mission. And then we also have the Peggy F. Murphy Community Grief Center, which is on the same campus. The Peggy F. Murphy Community Grief Center really intends to serve the community. This is not somebody that's just been served by hospice and those families that have experienced a loss. This is for anyone in the community that's experienced a loss. We offer individual grief counseling at no charge to the individual, and we offer groups of different types. So we know everyone grieves differently. So we know that somebody that's lost somebody somebody that's completed suicide is different than a loss of a spouse. We know that somebody that has lost somebody newly bereaved is different than somebody that's really been struggling for a long period of time. So we have different types of groups for those different types of grief, and we really feel like we want to individualize that as much as possible. And then the individual grief counselors, we have 5 full-time grief counselors, and they really just work with anyone that's needing just that one-on-one time with somebody to process grief. And like I said, that's at no charge to the person that's coming to have a counseling session.
I think that's a really important note to make about the services that you provided. It could be 20 years post-loss, and you're still available to, come and speak to one of your counselors at no cost to the individual. I think that's a really big part of your services here.
Definitely. I think one of the things that's a common misconception is that grief ends at some point, and grief does not end. Grief comes in waves, and sometimes those waves and what else is going on in your life really compound after potentially 20 years or even longer. And we believe that if you don't solve for the grief, that you and learn to work through it, not to get over it, not to move past it, but to honor the grief and be there present when you're experiencing the grief, that other things in life become more challenging.
Absolutely. The compounding effect is a big part of it. I completely agree with that. So tell our listeners a little bit about how volunteers impact your organization, and if someone was interested in becoming a volunteer, what's the requirements, or how do they become a volunteer here?
Great, yes. Volunteers are a huge part of our organization. And we currently have about 160 volunteers, and that almost is as many employees as we have. Our volunteers are really important to our organization, and they do many different things. So we have a Watchful Passage program where we say nobody dies alone on our service. So we have our volunteers that will go out and just sit bedside with somebody and spend time with them, doing, hand massages, foot massages, trying to be with them, reading books, reading sometimes scripture, depending on what the person's spiritual beliefs are. And that is a really important program that we have. We also have a veterans program. We honor veterans, where we honor our veterans that come on service. We present them with a blanket, and those are presented by veterans. So if anyone's a veteran that would like to serve in some capacity, that with Visiting Nurse, that's an amazing opportunity to be able to serve and to serve fellow veterans. We have garden volunteers, so if you ever come out to our location, you'll see that we just have beautiful grounds, and those grounds are not made possible just by Visiting Nurse employees. Mm-hmm. That's really all volunteers. We volunteers each take a section of our grounds and really make it their own and be able to make our grounds beautiful for our families. So that's a really good way to serve if you don't feel like you're comfortable with patient care or being around patients, or this is a way that still gives back to the families in that capacity and the patients that we're serving here. And then we have lots of different opportunities for volunteering. I'm just naming some of the bigger programs that we have, but we also have people that just come in and work, help us with the things in the office and try to make our, package up things for our patients. If they need supplies, package those, run those. If they need, if we need loading we have some volunteers that come in and help load our printers with paper and keep us just going, so that we can continue to focus on patients and not focus on some of the administrative tasks. So we just have a lot of different opportunities. So I would encourage anybody that might be thinking about volunteering to call and talk with us. We can find an opportunity for everyone that would be interested. It's a really big part of what we do and a big part of our mission.
Sure. Well, you mentioned at the beginning of the podcast that, if anybody was interested in coming out to visit the grounds, they could. And that's something that you and I did about a month and a half ago. And just even walking through your grounds and seeing the flowers and the gardens, and it's almost an escape. It takes you out of, you don't realize that you're still in Fort Wayne, because it's just so beautiful and it's peaceful, and you have that opportunity. So could you maybe speak to the walkway in the back where the different bricks are?
Yeah, we have, as you walk around the back of Hospice Home, we have, the sidewalks are just filled with bricks with people's names on them. And what's one of the really neat ways that you can honor a loved one, especially if they've been served by Visiting Nurse, you can donate a brick, and we put that in our sidewalk, so that as you walk back there, those grounds are just beautiful, but there's a little pond and a fountain and just beautiful flowers, and through that path you can see all the names of loved ones that have passed on our service. And it's just really a neat way to give back, but also a way for those that maybe want to come back and just walk the grounds and remember their loved one, that's a way that they could do that and honor them.
Sure, absolutely. So if someone's interested in getting in touch to volunteer, should we direct them to your website, or is there a specific place that they could go to gather more information?
Sure, you can go to the website, which is www.vnfw.org. So vnfw.org, or you can call our line. We have a really, what we find really important is that there's one point of contact, and when you call, you'll get a live person. So 260-435-3222. You just get a receptionist who will be able to direct you if you're interested in volunteering, if you're interested in learning more about the services we provide, or if you're interested in coming out and just seeing the campus. Mm-hmm. I love to show it off, because there's so much dedication and hard work from volunteers and donors and just everyone that believes in what we do.
It's a beautiful space, Southwest Fort Wayne. It's gorgeous. And you mentioned your receptionist, and I just have to give you guys kudos here, because from the moment you walk in, it's just you get the warm feeling of you're welcome, and if you have a question, anyone's willing to answer it, and so kudos to you guys for having that. Just your culture here is awesome. That's a big part of it.
Yes.
It is. It's a very big part of it. Well, Leslie, thank you so much for being a guest on the podcast. I can't wait to gain some more volunteers for you guys and just bring people to see the grounds, because it really is beautiful. And just real quick before we go, do you want to touch on the meeting space that you guys have here?
Oh, sure. Yeah, we do have two opportunities for a few different opportunities, but our community grief center does have some community meeting spaces, and they're fairly large. So one of our rooms can hold up to 50 people, and that overlooks the rooftop garden we have, which is really a beautiful space as well. And then we also have our lower level, we have about a reading room that can hold about 150 people. So there's just opportunities we want people to be able to use the space as a community center, and we want people to feel comfortable coming in. So any sort of outside groups or things like that, we would love to talk to you about potentially using that space.
Awesome. Well, we'll put a link to your website in the podcast description so people can click on that and contact you. But thanks so much for being a guest with me today. I really appreciated the conversation.
Yeah, thank you.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.